I would like us to start this beautiful expo with the Pledge of Allegiance. So if everybody could please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everybody, and welcome to our beautiful Town of North Hempstead Harbor Links for hosting, and we want to give a big thank you to them for hosting our Project Independence Conference and Expo. Without further ado, it's my great honor to introduce somebody who is definitely very special in our Project Independence program. He is the incredible host who comes every Friday into your ears via your radio. The incredible, the wonderful John Ryan.
Welcome everybody to the 5th Regional Aging in Place Conference and Expo. It's my honor to introduce first our council people who are here with us today. He's the North Hempstead Town Clerk, Wayne Wink. Councilman Peter Zuckerman. Councilwoman Lee Seaman. And Councilwoman Veronica Lurvy. Before I introduce Judy Bosworth, I would just like to say two things. Within the town, I do two different things. I do a program called Project Safe, which is Seniors Against Financial Exploitation. I am also the host of the radio program Project Independence in You. And that woman who made the clap is Christina Liu, and she is the producer of the program, and anybody listening to it, she's the one who gets the speakers. Now, in order to introduce Judy properly, I want to tell a little story. And I've told the story once before, and it's very important I want to tell it today. About 4 years ago, I was putting one of my grandchildren to sleep. At the time I had 2. Now I have 6. All right. So I'm putting Lucas, that's his name, to bed, and he has pictures of Batman, Thor, Superman, all over his room. And he says to me, "Grandpa, who's your favorite hero?" I said, which I shouldn't have, "I don't have a hero." He said, "Everybody has a hero." I said, "I don't have a hero." "But everyone does." Then I finally said, "I got to give in." I said, "Batman." He says that's his favorite too. With that, I give him a kiss and he goes to sleep. And I come downstairs and I'm sitting on the couch and I'm thinking to myself, why do seniors not have heroes? Why didn't I have a hero? And I started thinking of different people in my life, and Judy Bosworth came to mind. Judy Bosworth is here. Her parents are Holocaust survivors. Okay, she was a teacher. She was a wife. She is a wife, and she was a teacher. She raised 2 children, has grandchildren. She was the president of the PTA, went on to be a county legislator, and now she's our supervisor. Is that not a person to be proud of as a hero? Since Judy took over as our supervisor, she has done nothing but add to Project Independence. And yet, within the town, we have a AAA rating. So she has never taken from anything. She's only ensured the integrity, the fiscal integrity of this town, and improved services to everybody. When you look up here at the dais, you do not see a supervisor. Trust me. You have to look in your heart and you see a friend, your friend, the supervisor of the town of North Hempstead, the Honorable Judy Bosworth.
You know, he said it just the way I told him to. It's really good. Thank you, John. I'm really touched. You've given me a lot to live up to. Well, good morning, everybody. It's so wonderful to see you here for our 5th Project Independence Aging in Place Conference. I have it from good word. The breakfast was actually delicious. So thank you, Harbor Links, for doing the amazing job that you do anytime we have something here. So, you know, your presence here is really a reflection of the town, and Project Independence, and the dedicated staff behind everything that Project Independence has to offer our seniors in the town of North Hempstead. North Hempstead genuinely cares about each and every senior, and I'd say we spend every day trying to make sure that we're finding different ways to reach out, to connect, and I think the theme of today's expo, Operation Project Independence Connect, is so important because it's about trying to connect, making sure that we're connecting with you, that you're connecting with the services that you need. And it's aging in place, and I'd like to think we have a lot of years ahead of us of aging in place. We want to make sure that we do it right so that we're all here again and again and again hearing about all the latest things to help us do just that. The strength of Project Independence comes from our partnership with the Health and Human Service organizations, all our local senior groups, and our government agencies. I think the strongest part of Project Independence actually is the fact that every Project Independence group in a community has a Project Independence advisory group. So we're hearing directly from our seniors who are involved with Project Independence, what's going well, what's not going well. Because you can try, and just because you try doesn't mean it's going to be right. We need to hear if things need to go in a different direction. And by having the advisory groups, we hear just that. We hear what's on your mind, what you think we're doing that's good, and what you think needs to be done better. Because the minute you think everything is just fine, that's when you have to leave. Because it's never all just fine. We always have to be looking for what we can do better, how we can move forward, and that's the goal of all the people who are here working with Project Independence. So I want to especially thank the lady who introduced everything here, our Commissioner of Community Services as well as Department of Services for the Aging, Kimberly Crigalante. Her terrific staff who's here for us all the time. We have some very wonderful speakers today. One of them, the keynote speaker, is Dr. Maria Torella Carney. So Dr. Carney, I know Dr. Carney from Northwell, but here's a little secret. I know her from way before then. Because when I was a Nassau County legislator, Dr. Carney was the Commissioner of Health. And I will tell you, she is an extraordinary, I consider you a public servant because you devote so much of your time to the well-being of all of us who live in North Hempstead, who are part of now Northwell and beyond. So we're so honored that you're here and going to share your vision with us. And we're really fortunate that Dr. Carney is here. So let's. And I know all the speakers are going to be wonderful. So I know that we have experts on these panels and should be great sources of information for all of you. I'd like to take this opportunity to thank our wonderful sponsors, Northwell Health System, Parker Jewish Institute, Age Well. Let's hear it for them. They're major sponsors. AARP, Earworks, what'd you say? No, okay. Ronald Fatula, Esquire, Gerwin Family of Healthcare Services, and United Lifeline. And of course, all of the wonderful exhibitors who are here today, I encourage you to visit with them. They'll have great information and some pretty neat giveaways as well. So Project Independence has grown through the years, and while we still offer classic curriculum such as improving your balance and exercise classes, we now also include technology classes called, and I think aptly so, Technology for the Terrified. If you have kids and grandkids, they go onto computers, they have no problem. They're with the smartphones, and we're sitting there going, So we want to make sure that we are able to be in this new world of technology. It's not so new anymore, but it keeps changing, and it's important that we keep up with the changes. We want to make sure everyone who has a smartphone knows how to use it and can take advantage of all the different applications that are on it, because it really opens up a whole world. If you leave here today with any questions about Project Independence, or you'd like to take advantage of Project Independence services, please talk to our Project Independent representatives who are really all around the room and will be here all day. And you could always call 311, ask your question, and someone will get back to you. and visit our website, www.northhempsteadny.gov. If you're not a member of Project Independence, sign up. It's really tough. You call up 311 and you say, I want to be a member. It's as simple as that. So we're delighted that you're here. I want to, again, give a shout out to my colleagues in government, because without their support, we couldn't do any of the things that we do. Again, Councilman Veronica Lurvey, Councilwoman Lee Seaman, Councilman Peter Zuckerman, and our town clerk, I like to say the wonderful Wayne Wink, because they're here today. They want to see what they can do to continue supporting our seniors in the way that is so important and so vital. So thank you for being here. It was great to see you, and hope you have a wonderful day. Thank you.
Okay, our next speaker is going to be Dr. Carney. And I just want to tell you something about Dr. Carney, which is wonderful. The first Project SAFE program was done at the Unitarian Universalist Congregation at Shelter Rock, and it was an all-day affair. We had representatives from the UN, representatives from the Attorney General's office, representatives from the DA's office. Judy Bosworth was there. The most important part of it was that Dr. Carney, whom I didn't know at the time, acknowledged it, the importance of it, and came, which is very, very important. And she's gone on so much since then. When you have people like Dr. Carney working with Northwell, combining that with a supervisor like Judy Bosworth, that's why you have North Hempstead voted as one of the top 8 places for people to retire to in this country. And that was in Money Magazine. With health, with services, with socialization, that's what seniors need. It's not one piece of a puzzle. Fortunately, Judy Bosworth, the town board, the healthcare systems within the town have put together all the pieces of the puzzle to make it work for all the seniors in this town. And with that, I want to thank Dr. Carney and bring her up.
Thank you. Thank you very much. I really appreciate it. I hope you can hear me in the back. Yes? Okay, great. I think this is an example, Supervisor Bosworth, that there are honorable people of integrity that are in public service. So I'm very grateful to be here, and thank you for inviting me. We've known each other a while. Okay, so my talk is meeting the needs of an aging community. And I use a lot of the information here when I'm teaching at the Hofstra School of Medicine, which is now the Zucker School of Medicine at Hofstra/Northwell. So I'll speak to most of it. If you're unable to see it, don't worry, but I'll speak to most of the slides. I want to also just acknowledge my colleagues from Northwell Health, Susan Quietek, who's VP of Strategic Initiatives for Aging and Supportive Care, starting next week. Melinda Cooper, Joe Goldsmith, Barbara Vogel, Shannon Prasad, and Bill White, all from our work in the realm of making it easier to live independently and safely here in our region that Northwell Health serves. So on behalf of Michael Dowling and everybody in Northwell Health, the main message here is we are moving forward to improve care for people that are aging here in our region to live safely and independently for as long as possible. Okay. So my goal is to talk about the demographics, our current state of aging and supportive services at Northwell, and describe our age-friendly health system initiatives and the opportunities that we have moving forward, and some next steps. This is a dynamic slide, and it looks at the percent of the population in the United States from 1950 to 2050 by age. So to the left is the percent of the population under 5, and then all the way to the right is those over 80. And as you see, in 1950s, World War II veterans, they came to Long Island, they settled in Levittown. It was the first suburb of our region, and the homes were built for young families, right? And then now today, in 2000, almost 20, we have baby boomers turning 65. So every day, 10,000 individuals are turning 65. So we have a younger, older adult population in our region living in homes that were built for young people. Oh, there's Colleen Goldenbach. Hello. Everybody wave. So we have younger, older adults, and in the next 15 years, soon, our country will have more people over 65 than under 18 for the first time. So in a short 15 years, our society has to really change things up to serve a growing, aging population where everything has been established for young people. Okay, so we have to really adjust things. And so we'll go through what we're doing at Northwell. I'm going to go now through some slides of demographics and colors, and I'm happy to share this with you guys at another point. But this is the percent of population in our region over 65. And the darker the color, the higher the percent. So if you see the two H's, I can't, but if you know the region, you'll recognize where North Shore Hospital is and LIJ. They're the two H's very close to each other with orange around them. And orange means that the percent of the population is 20 to 29%. Most of the United States is about 13%. So we are in a aging population we're living. That's the over 65, but look at the over 85. We're in a dark area, right? So we are an older community. 65 and older living alone. A lot of us are living alone as we get older. That's very common with society. Whether we're a not white population, the darker the color means it's minorities. Below poverty level, we have an area, even though we're considered a wealthy region, we have people who are aging and living below poverty. And we live in a very high, costly rent environment. So we have a large percent of the population over 65 with rent burden. We are living longer though, right? That's the good news. Things have changed from 1968 to now. We have lower mortality in every age group. From the light green, under 25, mortality over time is decreasing, and even in the purple, over 85. So we are doing things to prevent and lessen mortality so people are living longer. And what does that mean? And what has contributed to our living longer? Clean water, vaccines, antibiotics. Now we're in modern medicine. We have defibrillators, knee replacements, all contributing to us living longer. But we're now living through diseases that we used to not live through in the past. So now we're living with multiple medical problems, and we're seeing people living with dementia. So they're dying with complications of dementia. Most every family has a family member suffering with dementia, along with their other medical problems. So we're seeing a lot of complex medical care. This is a slide looking at how other countries, where they spend money, whether it's on health care versus social care. And if we look at France, Sweden, Switzerland, and other countries, you see US in the middle, where our healthcare spending from our percent of the gross domestic product that we spend on healthcare. What do you see here? How does US compare to other countries in our healthcare spending, which is the light blue, versus social care, which is the dark blue? Right. The US compared to other countries spends much more of their gross domestic product on health care and less compared to other countries on social care. So the fact that we are living in a region such as Town of North Hempstead that has project independence, it's showing that we're ahead of time, forethought, focusing on social care. It's an important component of our ability to live independently and safely. New York State is home to the third largest older adult population in the nation. Third largest. California, Texas, New York, Florida are the top 4. And what's happened over time in terms of healthcare and hospital stays? If you see, the dark blue is the over 85 population, and the lower graph is the less than 65. So the number of hospital days we are spending in the hospital has decreased drastically in an older population, right? So from 1980, over 85 population spent about 12 days in the hospital. Today, or in 2004, it was about a week. So we've decreased stays in the hospital. And that's very good, because the longer you're in the hospital, you're at risk of complications and problems. But what does that mean? That means we are pushing care into the community, right? Many of us, if we're hospitalized, we go home, we're weaker, we need more assistance, we may be sent home with catheters, with complex medical regimens. It's a changing world, and I'm sure many of you have felt this caring for your loved ones at home. So caregiving is a big component to health care, and we don't think about it. As we get older, we think about just living independently and driving, but we have to start thinking about who's going to provide us our care, who's going to make our health care decisions, right? What is our plan should we have a problem? And caregiving is a huge component we do not plan enough about. There are formal caregivers, nurses, LPNs, aides. There are about 5 million of those in our nation. But the majority of caregivers are spouses, children, friends, and neighbors, 42 million. That's about almost 20% of our population is in a caregiving role. And baby boomers are entering this phase of where they may be in need of care. So there's this invisible healthcare workforce of caregivers. It could be your spouse, it could be your child, it could be your friend or neighbor in that role. At Northwell, we have geriatrics and palliative medicine focusing on individuals with complex medical and care needs. The blue dots show where we have teams in all of our hospitals, inpatient care teams, focusing on geriatrics and palliative medicine to improve quality of life, help people make complex decisions. The red dots are where we have outpatient practices, and the green dots are where we formally have relationships with nursing facilities, okay? So we have quite a spread of specialized care focusing on an aging population. And this is our goal in all of our regions, and we do well here in this region. We have our outpatient practice at 410 Lakeville Road, where we provide senior health and palliative services. We have a team at North Shore and at LIJ that we communicate with. And we have our teams at Stern Center for Rehab and Orzac in LIJ Valley Stream area. We utilize home care, Northwell at Home, our hospice care network, and any home-based services, whether it's a house calls program or delivery of services, to help individuals stay home and out of the hospital. And we communicate. We try to communicate to help the continuum of care. But the new entity, what we're trying to focus on is how to provide caregiver support and link individuals to resources to help them live safely and independently. We use data, we focus on quality, we're training individuals and research. Our areas of expertise are memory care, caregiver support, multi-morbidity, helping people with multiple problems, people who have advanced illness, transitions of care, where they're trying to, should they be living at home? Should they be in the hospital? Should they be a skilled nursing facility, assisted living? And we're experts on models of care serving this population. I'll talk a little bit about our geriatric emergency departments. We have an assisted living program where we see people at certain assisted livings. We're developing care teams at home. And we have developed supportive oncology and supportive cardiology to work with our colleagues in oncology and cardiology to help their most complex patients. But we're more than just a hospital. We have our outpatient doctors, we have our hospital, but we have post-acute services where you may be seen in your office. A patient may be seen in an office, they may get hospitalized, they then go to perhaps subacute rehab at a skilled nursing facility for short-term stay, and then they go home. But at some point, all of us may have to consider when is the appropriate time for hospice care, right? That's where we want. We want to manage this phase of life, keep you independent and safe, have a high quality of life for as long as possible, but then try to understand when a hospice approach is appropriate. That's our goal. And post-acute services at Northwell is home care, skilled nursing facility, and hospice care. And within home care, we can provide aids, services to help you live independently, to help in the caregiving realm. When is that appropriate? When do you hire? When do you have access to benefits to pay for it? We can help you with that. And the whole team in the back there are the ones to go talk to. Everybody wave your hand so they know, okay? But we have challenges in our community. We do this pretty well, but it's still not enough based on the demographics of our region. Our challenges are dementia, right? It's epidemic. Caregiver resources are limited. How do you access them? Transportation, access to specialized care is difficult and limited. And the health system has limitations or challenges. Our workforce expertise, having time to have good communication about goals of your care and understanding what your situation is. How to get a social worker to help you if you're not in the hospital. Staffing challenges because we're all very busy. You've been to doctor's offices. It's a crazy environment. The coordination of a lot of services is challenging. Accessing matrix of services. And there are environmental restrictions. Getting to a hospital, parking, walking across to the hospital to visit your loved one is not simple. And there's ageism out there. And how do we market our services better? So we have challenges. So what we are doing now is we are setting forth to create an age-friendly health system with Michael Dowling's support. We're going to focus on the 4 M's of geriatrics: the mind, medication consolidation, reconciliation, avoiding harmful meds, mobility, preventing falls, being safe, and what matters most. What are your goals of care? What's most important to you as you're making complex decisions? We're going to try to create centers of excellence in the inpatient hospital settings, centers for senior care outpatient settings. I'll tell you a little bit about our practice. And primary care, really emphasize how to geriatricize primary care, focusing on the 4 M's, and then linking to post-acute. We're going to train, we're going to research, and we're going to advocate for what people need. And partnering with Project Independence is very important to us. So what we've done is we've done an inventory of all of our hospitals and all evidence-based services, and we're just trying to fill in those gaps. So our initial findings are that we need to improve ambulatory practices and access. We have a lack of geriatric and palliative medicine expertise. There are some, but it's limited. And specialists in this skill set are limited. But we have some great system best practices that we want to replicate elsewhere because it's not widespread. And there's opportunity to highlight centers of excellence. So our goal is to become an age-friendly health system We are initiating this now. We have work to do, but it is a priority for Northwell Health. We're going to grow our ambulatory programs. We're going to pursue national recognition. We have achieved some, and I'll tell you a little bit about that. We're developing and identifying our centers of excellence. We're optimizing our existing assets. We're going to expand and integrate with post-acute services, which is home care, hospice, skilled nursing facility, and we want to enhance the patient experience and safety. So we have gotten some national recognition. North Shore University Hospital and Lenox Hill in the city have been named recently top 50 in the nation for geriatrics. And we have other hospitals that are high performing and soon, with some effort, will become in the top 50, such as LIJ, Huntington Hospital, Mather out east, and Northern Westchester. Some of our hospitals have gotten magnet and niche designation. These are nationally recognized designations for older adults and the high quality of care, and we're pursuing that in all of our hospitals. We have 15 hospitals that, actually I think it's 17 now, currently have geriatric emergency department accreditation. So we're very proud of that. I'm going to keep going. We're going to optimize existing assets. We have many patient-centered medical homes in our health system, and we're focusing them to be more age-friendly. We have developed a geriatric ortho hospitalist co-management program, improving the care of individuals who have had hip fractures. And we have an aging and advanced illness initiative or collaborative that we are going through the whole health system. We're partnering with community programs like Project Independence, and then we have our wellness and integrative medicine program in Roslyn, and we have representatives here from that, and they have a table in the other area. And we're redesigning social work services so that you can access a social worker before coming into the hospital, like Barbara Vogel in our office. Some of our hospitals have caregiver programs, and a few of them have caregiver centers in the lobby where you can go and access resources or learn more about resources that exist to help caregivers, because we realize caregivers are essential to good health outcomes. Peconic Bay, these are photos from our Peconic Bay Medical Center, Caregiver Center. North Shore University Hospital will be opening one. They're breaking ground, I think, next month. So hopefully in the spring, we'll have a caregiver center in the lobby of North Shore University Hospital. Post-acute, I mentioned. We talked about subacute rehab, assisted living programs, and home health, how to access care at home. And again, our team in the back can help with that. And this is an initiative that we need all through society. How to improve our environmental safety, our signage, our walking, places when you're walking tired, can you sit? Can you get assistance? And really reevaluate. Our society has been built for young people. We have to reevaluate everything. So we are undergoing an environmental assessment of all of our hospitals and offices to make it not only disability friendly by law that we have to, but how it's just easier to work around and walk around. Again, we are setting forth an age-friendly health system initiative linked so that the goal is our outpatient, inpatient, skilled nursing facility all link and talk, and we utilize home care, home-based services, hospice to help us, and we focus on caregivers. And this is our office, which is at 410 Lakeville Road in New Hyde Park. It's our Northwell Center for Senior Health. It's home to our geriatric medicine and palliative medicine faculty. The phone number's there. We provide comprehensive primary care and consultative services focusing on mind, mobility, medications, and what matters most. and it's staffed by expert clinicians, geriatricians, and palliative medicine physicians, and we serve as a resource of education and dissemination of best practices. Please feel free to call. Joe Goldsmith's the office manager back there. Wave, Joe. There. We have 8 physicians, 2 nurses, a social worker in our office, Barbara, a pharmacist, and other supportive services. You check in at the front desk. You're seen by a medical office assistant. This is new technology for me. You're seen by a physician, by a pharmacist, social worker, and nurse. Multidisciplinary. And then you're checked out and you go forth for labs, referrals, and schedule follow-up. So I'm just going to leave you with some tips, what I think you can do to prepare yourself and your loved ones to age in place or to live as long as possible independently and safe. 1, find a physician and healthcare team that treats you comprehensively. Enjoy your life. Celebrate. Have gratitude. Studies have shown that if you have gratitude, you live longer. And I see that with my patients. If they have gratitude, their quality of life improves and they live longer. Think about where you will live when you can't drive. Are you in a place that you will have the support when you can't drive? Who will make decisions for you, whether business decisions or healthcare decisions? 2 separate. Who's your healthcare proxy? Get a healthcare proxy. Who will care for you? What happens when you need care? We need assistance walking, dressing, getting food, transportation. So make a care plan. How to communicate how you want to live and where you want to live and what's important to you. So I said identify your healthcare proxy, discuss with them your health so they're educated and your goals. And if you are a caregiver for someone else, take care of yourself. Promote age-friendly care for you and your loved ones. Ask and advocate for what's important to you. Thank you very much.
Thank you, Dr. Coney. That was wonderful. The slideshow was perfect, too, because listening to something is wonderful, but seeing it come up is great.